Good afternoon, and thank you so much for taking the time to join me in reviewing the ARPA funding opportunity, Nevada school-based dental health programs, implementation and expansion. This presentation will serve as a guide for completing the application with this funding opportunity. All applicants are strongly encouraged to carefully read and follow the RFA as written when completing their individual applications. So what is ARPA funding? The American Rescue Plan Act in 2021 delivered over $350 billion to states, territories, local and tribal governments across the country to support their response and recovery from the COVID pandemic. And in 2022, Nevada awarded the Nevada Medicaid Dental Services with $2.6 million to support grants to school-based sealant programs, either for their expansion or their implementation throughout the state in order to improve the oral health of children and youth. So why school-based dental sealant programs? We know that dental sealants are an evidence-based approach to preventing tooth decay. They're placed in the back molar teeth, and that is predominantly where tooth decay will begin. And on average, dental sealants are underutilized, with less than half of school-age children and youth having at least one sealant. And this is very true for the state of Nevada. So evidence also shows us that school sealant programs are most effective because we can deliver the sealants where the children are spending most of their time, which for those children that are school age, that's where they're spending most of their time. So it's an effective means for delivery. So just a little bit of information about this particular grant opportunity. It's going to be one-time awards of up to $70,500. It will be reimbursement-based. Awardees will not receive an upfront check of $70,000, but in fact will be reimbursed over the next year. Existing school-based dental health programs are being asked to expand to new schools and or new grades. And the funding may also be used for new programs wanting to come and begin school-based sealant programs in the state of Nevada. Those programs serving rural dental health professional shortage areas and Title I schools will receive additional consideration for funding. So who may apply? Nevada's health districts, community and nonprofit organizations, federally qualified health centers and other community-based clinics, Medicaid dental service providers, including public health endorsed dental hygienists in the state, school-based health centers, educational institutions of higher learning, school districts and schools, including charter schools, and other Nevada licensed entities. So predominantly just about every organization, nonprofit or government-based institution would be able to apply for this particular funding. Again, please refer to the RFA for those specifics. So what may the funds be used for? Equipment in order to implement the school-based sealant programs, hard and soft dental supplies, dental materials, PPE or personal protective equipment, emergency medical supplies, consumables such as toothbrushes and floss. Educational materials can be developed with this information. Translation services, if there are consent forms or other materials that need to be translated in other languages to serve children and their families, that may be included as part of the funding, as well as personnel. So let's review the application. Again, for new applicants coming into the state who are using this funds for startups, there would be 8 components to your application. For existing school-based sealant programs in the state of Nevada, your application would include 7 components. And I'll go over this, and again, it's also included in the RFA. The first component is the cover letter. It's actually attachment A in the actual request for applications. It includes basic program information and contact information. We're also asking if there's an entity overseeing the program that information would be included, as well as, say, the person who's implementing or managing the program's contact information. At the point where you would be awarded funds, as well as looking for reimbursements, every awardee or sub-awardee would need to have a Nevada vendor ID and a unique entity ID. I've included information on this slide where you would be able to find out more information. This information is also in the RFA. You do not need to have either the Nevada vendor ID nor the unique entity ID in order to apply for the funds. You simply need them at the time that you would be awarded funds and asked to sign the contract, as well as for your reimbursements. A signature is also required on the cover letter as well. For existing programs that are currently providing services in school year 2023-2024, we're asking, 2022-2023, we're asking you to provide information about the sealants and the schools and the counties that you've been in this past school year or this current school year. So this chart you'll see is actually is part of the RFA. It's within attachment A. So if you're an existing program, also please complete this chart. So let's talk about the scope of work. This is primarily the major part of the application. This is where we can envision what you're planning on doing as we're reviewing the applications. So we're asking you first to provide data on the unmet oral health needs of the children and youth in the service areas where you plan to begin or expand the school-based sealant program. We'd like you to describe the activities that you'll be conducting to increase the number of students receiving sealants, fluoride varnish, and referrals to a dental home. Perhaps you'll be starting out this summer, in fact, attending community events to promote that you'll be in the schools. Maybe you are going to be meeting with principals and school nurses. Maybe you'll be a back to school night, setting up and tabling there to let the parents understand what the services are that are being provided. All of that would be included as part of what you're going to be doing to increase the number of students receiving sealants, fluoride varnish, and those referrals. If this is a new school-based sealant program, please describe the detailed activities you plan in order to become operational within the first 120 days of the start of the school year. Continuing on with the scope of work, we'd like you to describe the expanded or new school oral health preventive services you'll be providing with the assistance of the ARPA funding. This needs to include what sites you plan on providing services, what grades you plan on providing services, and also identifying which schools are Title I, as well as which schools have children participating with 50% or more eligible in the free and reduced school lunch program. Finally, we'd like to understand through a description or written narrative how the equipment and or the supplies you're going to be purchasing with this ARPA funding will enable you to expand the delivery of dental sealants and fluoride varnish and increase the number of students served at your school-based sites, whether or not there are additional schools and or additional grades at existing schools. As a reminder, this information should align with your proposed budget. So for example, if you're describing that you're going to be expanding to to new schools and hiring additional personnel in this scope of work, we also need to see that outlined in the budget. The next component is the timeline. We'd like you to include a timeline for implementing and or expanding the school sealant program in preparation for the start of the school year as well as during the school year. So what will you perhaps be doing? As we mentioned earlier, will you be attending community events? When will that be? When will you be sending out consent forms? When will you plan on doing screenings? How soon after will you be applying sealants? When do you plan on going back to check the sealants and their integrity as well as apply fluoride varnish again, perhaps? All of this needs to be outlined again so that we have an understanding of what each program's planning when we're reviewing the applications. As part of the timeline, we'd like you to include at least 2 SMART objectives. SMART is an acronym that we use in order to develop measurable, achievable, attainable, relevant, and timed objectives for evaluation purposes. If you've never developed a SMART objective before, at the bottom of this slide, there's a web address for the Centers for Disease Control and Prevention. You can also Google CDC and SMART objectives, and clearly they will outline for you what a SMART objective is and how to develop them yourself. We want to be sure that the SMART objectives are student population focused, meaning we want to see a measurable change from the beginning or what's planned until the end. We don't want the SMART objective to be focused specifically on what the program will be doing. Those would be considered perhaps a process objective. We're looking for a product objective, which is the SMART objective. You'll also be required to report measurable results based on these SMART objectives. So please be sure that you are including achievable SMART objectives in your application. On the right-hand side, I've included examples. In green are the effective SMART objectives, and the one in red is not a SMART objective. It's more a process objective. So if you take a look at the 2 examples, but the first one, by December 31st, 2023, 100 7th graders will be screened for dental sealants compared to no 7th graders screened in school year 2022-2023. So in terms of it being SMART, the S means it's specific to what we're looking at. M is measurable. We're looking to see if we can do 100 7th graders compared to none the year before. It is attainable, it's relevant to the project, and it's timed. We want to do this by December 31st, 2023. The second SMART objective in green focuses on 2 additional 2nd graders or 200 additional 2nd graders receiving sealants by the end of school year 2022-2024 compared to this current school year 2022-2023. Forgive me. So again, it's very specific to the population that we're working with. They're measurable, attainable, relevant, and timed. Compare that to the objective in red. By the end of November 2023, consent forms will be distributed to the elementary schools in Mineral County. While it's pretty specific, and of course it's relevant to the project, it's inwardly focused to what the program will be doing for the program. It's not measurable at all. So again, you want to be sure that you have a SMART objective that you're developing, you're including 2, and that they're outwardly focused to the population, not specifically inwardly focused to the program. Another component is workforce. We'd like you to describe the experience of the applicant organization and/or agency to provide school-based services in a general sense. What we'd also like you to do is describe the proposed expertise and skill of any new workforce, as well as the expertise of existing workforce that will be delivering these school-based services with this ARPA funding. Sustainability is another component that's required of all applicants. We want to understand how you plan to sustain the work that you're doing in school year 2023-2024 into the future. Will it be sustained with Medicaid reimbursement? Do you plan on getting grant funding? Is there funding coming from another source that will help you to sustain the program? What we don't want to see is a program that's expanding services one year with this ARPA funding, but then there's no sustainability plan for the program for the next school year and going forward. Remember that you can apply for funding for personnel. If personnel are being requested, we would like you to describe how you're going to sustain the new personnel you're hiring for school year 2023-2024 because of this ARPA funding. Please remember that you may not supplant ARPA funds for current funding that you're using to support personnel now. So what that means is that if you're hiring, if you cannot use the new ARPA funding to support existing personnel. What you can do, though, if you wanted to expand a part-time employee to a full-time employee, you could request funds to cover the new or additional hours that employee will be working because of the expansion. Again, you would need to supply information as to how you're going to sustain that person at the end of the ARPA funding or the beginning of the 2024-2025 school year. Any questions about any of this, please be sure to contact us for clarification. So the budget is the next component. We're asking you to submit a primary budget, which again may not exceed $70,500. We'd like you to use attachment B, which is included in the RFA. The funds that you're requesting should be directly related to those items that you need in order to begin or expand a school-based sealant program. We also need this outline of funding in your budget to be directly related to the scope of work, the timeline, the workforce, and sustainability that you've discussed in the application. Now, you may also request supplemental funding up to an additional $70,500. You would be following the same guidelines as the primary budget. You would still be using attachment B, but you need to be sure to outline that it's your supplemental budget, though we cannot guarantee we'll be able to fund a supplemental budget. But again, we're asking if you do need additional funds to include the budget, a supplemental budget, but do know that we can't guarantee that we'll be able to fund that. Now, we are able to include indirect costs as part of the budget. So for applicant organizations that have an existing negotiated indirect cost rate, you must include a copy of the agreement with your application. For applicant organizations that do not have that existing negotiated indirect cost rate agreement, you may include up to 10% for an indirect charge in the budget. Please note that this is part of the $70,500, meaning that your direct plus your indirect costs may not exceed $70,500. Along with the budget, we need a justification. The budget justification will be a narrative explanation for each one of the line items that you included in attachment B. We need clarification on where the total sum for each item in attachment B comes from. That's included for the direct costs as well as the indirect costs. If you're looking for supplemental funding or requesting that, we also need to have a budget justification for the supplemental funding. There's an example on the right-hand side of the slide of what a snippet of the justification may look like. You'll see that the equipment total in attachment B requested was $18,021. There's a slight narrative, a brief narrative that refers back to the scope of service and the workforce sections in the written application, but then we've detailed out what each line item would be that we're requesting funding for, excuse me, which totals $18,021. Please remember that you will be requesting a reimbursement and we will be needing invoices. So we'll also be looking at this budget justification and your budget when we're reviewing the invoices for reimbursement. So those were the 7 components that a potential applicant who's already been providing school-based services would have to include in their application. The 8th are letters of support, and that's for new school-based sealant programs. So those programs that are looking for startup funds from the ARPA monies. We need at least 3 letters of support to be included with the application. Those letters of support can come from organizational leadership, perhaps the school district where you're going to be providing services, a school principal or school nurse where the services are proposed. These are examples of who may provide those letters of support. So let me briefly go over the expectations of the Department of Healthcare Finance and Policy in regards to our ARPA grantees. Again, as a reminder, all grantees must be enrolled in the System for Award Management, which is really the federal component that awards or distributes the unique entity ID. All grantees must also be vendors of the state of Nevada. Please remember, this should not preclude you from applying for these funds if you don't already have each or either of these numbers. You can get them as soon as you submit the application. You don't need to have them to submit it. New school-based sealant programs need to notify us in writing when they're operational, and the expectation is that it would be within 4 months of the start of the school year or December 2023. You'll be submitting invoices for reimbursements up to the $70,500. We'll be asking for them to be submitted once per month. We will be reviewing those invoices, comparing them to the budget and the budget justification that you've submitted. Final invoices must be received no later than Wednesday, May 22nd, 2024. This is because the ARPA funding ends and our program will be ending by June 30th, 2024, and we need to be sure that you are reimbursed. Funded programs are required to provide regular data and qualitative updates on performance, including program expansion and sustainability. And let's go over that. The reporting requirements are part of Attachment C in the RFA. All grantees must provide quantitative and qualitative reporting from school years 2023-2024 through school years 2027-2028. The reason that we're asking that is to be able to understand better how we can support school-based oral health programs, what the successes and challenges have been in terms of implementing those programs, and also being able to identify gaps where we need to implement services where students aren't receiving this valuable care. We'll also be asking you, as part of the qualitative updates, to be providing related to those SMART objectives that you included in your application. We'll also, again, be asking about your successes and challenges. Quantitative updates will be required twice a year in December and June, and that qualitative update will also be submitted in June. Please refer again to attachment C in the RFA so that you can see what information we'll be requesting. So in summary, the primary funding requests are up to $7,500. Application should include 7 components if you're an existing operational school-based program, 8 components if you're brand new to the state of Nevada using this funding for startup. Application should be no more than 10 pages in length. We're not including the budget and the justification in that 10 pages. The application should use 12-point Times New Roman font. The size of the margins is up to you. The application deadline is Friday, June 30th, 2023 at 5 p.m. Pacific Standard Time. And we're asking you to submit 1 file with your application and submitting it electronically to dental@dhcfp.nv.gov. Any questions between now and the application deadline of June 30th may be directed to the same email address at dental@dhcfp.nv.gov. We'll return that email within 24 hours or sooner. We can also set up a phone call or a electronic meeting to discuss any questions or clarify anything within the RFA. We're looking forward to receiving your applications and partnering to improve the oral health of school-age children throughout the state. Thank you so much for joining.